look at the etiologies of shock. Again, say pump problem, a popping problem, or volume problem. So let's look at volume loss. And how do we develop volume loss? Well, volume loss can range from a few different ways. You know, what we most commonly think of is volume loss from trauma. So somebody has a significant cut, maybe internal bleeding, and our blood is leaving our vascular space and going either outside the body or just at least outside the vasculature. So we're losing blood of some form. So if we lose blood, then we don't have the blood to pump, so that's going to drop our blood pressure. And if we drop blood pressure, we lose perfusion. So when it's not just blood loss, so we have, and this is what we're saying, hemorrhagic shock. So hemorrhagic shock is actually blood loss. Then we have conditions of volume loss that is non-hemorrhagic volume loss or non-hemorrhagic shock. And non-hemorrhagic volume loss is basically we're losing the water from our vascular space. So, and that can be from burns, we may lose plasma from burns, dehydration. So somebody's been sick for a while, maybe they're just not able to eat or drink anything, they're vomiting, diarrhea, anything, but we're having significant volume loss. So in that case, we're losing the water, we're losing the interstitial volume, but we're not losing blood because the blood's staying behind. We're not necessarily losing it. So in the case of volume loss, we have hemorrhagic volume loss, meaning we're losing blood, or we have non-hemorrhagic volume loss, where we're just losing the water or plasma. And again, it doesn't necessarily mean it's leaving the body. It could just be going to other parts, especially our non-hemorrhagic volume loss. Maybe doing what we call a third space, our interstitial space. So blood could be collecting under the skin or in different components. It's just left the vascular space. So if we leave the vascular space, our volume is not there to be pumped, and we're going to lose blood pressure. So I mentioned it's either a pop problem, a pump problem, or a volume problem. So we talked about volume problems. So let's look at the pump problem now. So looking at one of our other etiologies of shock is a pump. So if our pump is not pumping efficiently or properly, then we lose stroke volume. If we lose stroke volume, then we lose blood pressure. Now, it's not just the amount of blood the heart is pumping, because our blood could be pumping in each contraction, have a good ejection fraction or good stroke volume, but if a heart rate is either way too low, then that could lead to shock. Likewise, if a heart rate is really high, then it does not allow the ventricles to fill properly with blood. So then when we do contract, when a heart contracts, it doesn't have the volume there to maintain blood pressure. So the pump could be a cause from a few different things. Either the pump itself is not working properly, it's maybe the heart rate's too fast or too slow, and those are your main components. So anything that's affecting cardiac output is going to affect blood pressure. And our last etiology of shock is popping or vascular space. So when we start looking at what components do we need for blood pressure, right? You need a good stroke volume, you need adequate heart rate, and you need systemic vascular resistance. So in this case, where the cardiac output, the stroke volume, and the heart rate deals with our cardiac output, our third component is our systemic vascular resistance, and this is where vasodilation comes into play. So if our vessels just open up, and that's what we say in this container or popping problem. So if we have not changed anything with our volume problem, but if all of a sudden our container space is opened up, then we have less resistance to pump against. So if we have less resistance to pump against, our blood pressure drops, and that will lead to hypoperfusion. And there's a few categories of shock associated with a popping problem, and looking at vasodilation, and we'll talk about those in a little bit. So in summary, pump, pop, volume, or pump, container space, volume. So pump's the heart, our container spaces or popping is our vessels, and our volume is our blood or the components of blood.